Good morning, everybody. And as we start this beautiful Tuesday morning and this nice weather we're having, it's good. But the problem with nice weather is that people like to socially gather and stop following by the rules. So, yesterday we had one, the day before we had one. It looked like, we hit that trend from that party that was on Hudson. And the day before that we had, I think it was 17, then it was like 13 and 13, and then we went down to 8, 10, so forth. So it looked like it was that trend. So it was good. Not good that happened, but good to the fact that it looked like it was the trend that we were hitting going forward. So as we looked at the tracing and the epi department does at the Department of Health, thank you to all of them and what they do, and Mary Beth Miller and everyone down there and her whole team that does a phenomenal job, and not just them, the nursing home and everyone else that's been on the front line in the county, thank you. But as we go through it, we got 27 new cases today from yesterday. So our number today is 2,125 positive cases of the COVID-19. We have 578 people under mandatory quarantine. Like I said, that's up 27 people from yesterday. So to the epi people and to everyone doing their job, which they do a great job for our health department doing this, and it's actually been utilized across the state of New York for the job that they're doing. But we know 5 of the cases are healthcare workers that are getting tested once a week. 4 reported travelers, so 4 people coming back from either traveling to states they shouldn't have been traveling to, or just coming back from their winter homes. 9 are close contact to positive cases, so that means out of the 27, 9 people were in contact with people that we already knew were positive, so that's part of the tracing. And 6, here's the one issue that we have, is a clear source of infection at the time, meaning that 6 people had no contact with anyone. So when they did the tracing and they went around and they were trying to figure out where they went, where they ate, if they ate, who they were traveling with, who they had close contact with. And these 6 people at this time had no contact whatsoever with anyone that shows that they were in contact with somebody either that was positive or somebody that might have had signs or symptoms, that we've been tracing. So, and like I said, the 22 cases so far linked to Hudson Avenue party. Again, we talked about that in the last couple of days, and I was hoping before I get to the dashboard that was just a fluke, that we had this party. Some kids came back and they're just trying to enjoy their lives, but as you see these numbers, these are things we have to watch out for. There are 77 active cases in Albany County now. 6,574 people have completed quarantine. Out of those, 2,048 tested positive for the virus and have recovered. That's 17 new recoveries since yesterday. We still have 3 people that are hospitalized with a hospitalization rate of 0.14% of those have tested positive. Yesterday, the rate was the same, stays the same. We have 1 person currently in our ICU that they went in on, out of the 3, went in on Sunday, still in the ICU. And if you look at our ICU rate, really between July 8th and the 18th, we had no one in the ICU. So that was great, and some of the things I'll talk about on the dashboard. It's hard to explain. One of the questions we get now is that we're seeing this number go up, but we're not seeing the hospitalizations, we're not seeing the ICUs, we're not seeing people intubated, which is all good stuff, but I can't explain it. I know we keep looking at CDC, we're looking at the scientists, we're taking guidance from the state, from the feds, and basically it seems like this COVID-19 is morphing into different things and affecting people differently. But again, it's just speculation because everyone's trying to figure it out as we move forward. But over the last 5 days, there's been an average of 11.8 new positive cases each day. That was yesterday's average was 9. So I'm encouraging everyone, get tested. Please get tested. Get tested. They're letting anyone get tested now, whether you have signs or symptoms, and I'll get into a reason why when we get to the dashboard. But please, Albany, in the Sethku Arena, you got the drive-through, you got the walk-up, you can go there. As always, the number is 364-3065. We have our mobile testing sites that, again, we need you to get out, get tested. Please help us, get people to this. So that number is 518-465-4771. Rite Aid and Colony, as always, go online, make an appointment. Pretty simple. You drive up, they swab your, you self-administer, you swab your nose yourself, you put it back, hand it to them. Very simple than getting the thing all the ways down your nose, and that's very uncomfortable because I've had it done. So, also, please, the Priority 1 in Gilliland, they're there too. They do the antibiotic testing, and you can call them at 518-867-8040. And remember, the 4 key elements, we need to continue to stop the spread is to wear a mask out in public. I know people don't like it, and please, it's for your own safety, but it's for the safety of people around you. Cough into your arm, wash your hands continually, and social distance. That's how we're going to stop this spread. That's how we're going to stop this from coming back. And please, and wearing your mask correctly. I know Dr. Whalen's gone over this a ton of times. I've walked into food establishments and different places, and the workers will have it under their nose like this, like Dr. Whalen was explaining. It doesn't help you. It doesn't help you. And not unless you got a barrier up, and even then, if you're prepping food, you still want to have the mask on. So I know she's covered that, but please continue to do that. We need to continue to educate ourselves. And I say this to the consumers and to the workers. We're in this together, and you can do it in an easy, nice way. You don't have to get into an argument. You can say to the worker, "Hey, put it on your nose," or the person, "Please, for my safety," or the people around you. You can do it in a nice, friendly way, and trust me, if they don't, most stores now I'm seeing have on their door, if you don't have a mask, don't come in. We're not serving you. So you're seeing more and more of that. This is how we're going to do this, getting this together to get it done. I know there are a lot of people out there who may thinking the coronavirus is not very serious. I know because of the numbers and what's going on. I get that from people I know all the time, questions we get constantly. We're not here to scare you. We're not here to give you a hard time. Look, it's just the data, and it's what's going on. And what we were faced with on early March, 132 days ago, and I didn't think we complete 19 weeks this Thursday, going into 20 weeks on Friday. I didn't think I'd still be doing this, to be quite honest with you. I was hoping, like everyone else, this is going to pass and it was going to move forward. But we don't want to roll back the reopening. I'm fighting to get gyms and movie theaters open every day. We get on the control room, we talk to General Murphy and everyone. When are we going to get guidance for gyms? When are we going to get guidance for movie theaters? We got to get back to some self of normalcy, but we have to do it safely and protect the health of people, right? But the last thing we want to do is close restaurants down or go in and start doing that or enforcing fines on businesses that, quite honestly, are struggling to stay open. So please help us. And again, being in this together, we can get through this. So the governor talked about rolling everything back the other day at his press conference. And that's the last thing I want to do is saying to businesses that are now trying to be open and creative and putting people back to work that you have to roll back. In the control room yesterday, we had the State Liquor Authority was on and talked about bar operations and made clear of the orders of alcohol beverages in restaurants or bars that you need to order some type of food. Cuomo chips, pretty inventive, pretty funny. I actually enjoyed that, thinking outside the box. I had other people call the same thing. If I sell popcorn or do this, yes, you can't be bellied up to the bar. I know that really hasn't been that much of an issue here in the Capital District. It's more New York City. Yes, I know we have our control room, and yes, that what happens in New York City shouldn't be affecting us, but it is. We were told what one region happens to them, it's not going to affect another region. But in this case, I think he's just being cautious as governor, saying, look, I want to stop this. it's nicer weather. People are starting to get out of control on this at bars, but we didn't really have this much of an issue here in Albany County. So I do want to thank you to the bar owners and that. And again, it's all new to everybody. We're in this together, and I know a few companies, bar restaurants, I can't think of the place down on Broadway that decided not to open up because it is hard. When you get up from your table and you have to put your mask back on to go to the bathroom, or you're sitting at the bar, make sure you have your mask on if you're not 6 feet. People forget as they're sitting there hanging out, having a good time, and trying to forget what the world has changed on them and everything going on. So again, we're in it together, and there's a nice way of doing it politely to say to somebody, please put your mask on, versus being confrontational. And if they are, walk away. It's not worth it. It's not worth the argument. It's not worth the debate. Just walk away. So again, to the restaurants and bars, I've been close contact with a lot of them. We are trying to work with you with the SLA. We're trying to make sure that you get the clear information. So again, we don't want you to get in trouble. So the other stuff that we've been dealing with, so they're only allowing to travel within capital regions. One of the things I've had this question through AAU and different sports organizations. I think the governor's pretty clear with his executive order on this. No out-of-state travel, even into states that are not on the 19 states that are saying do not go to because they're a hot zone or you got to self-quarantine for 14 days. You had the lacrosse team in Warren County. I've gotten numerous phone calls about basketball tournaments going on outside the state. These kids are supposed to play within the region, meaning that if you have a basketball league here in Albany County, they should be playing within Albany County. If you have one in Saratoga, within Saratoga, they don't even want them crossing for obviously reasons of why you saw the outbreak with the lacrosse team, and you have the potential outbreak of other kids going into other states in like New Jersey or wherever they're going and having a tournament, and you don't know where them kids are coming from or the parents. It's just trying to stop the spread. So I know parents, I know your kids want to play, I know they want to get out there. Just play locally. There's, I don't think it's going to really hurt them not to go out of their county or state to play in a, lacrosse or basketball or soccer, whatever it may be. Please, the governor's pretty straightforward on that. There's no sports that are supposed to be doing that, no sports. So the ones that are doing it, we're getting the complaints in. We will be following through. So just to make you aware of that. So please. The last thing we want to do is shut down any business, or the last thing we want to do is try to stop kids from having fun, but we want them to do it safely and make sure that they do it in a manner that they're protecting their health first and foremost, and their teammates and their parents. So I'm going to go over the dashboard, but I want to talk about the group that I've been talking about for the last 7 weeks. And it's the kids that are 20 to 29-year-olds. And we've officially hit our 405 mark with positive cases of that age group. And it's something that last week I think it was at 367. Something we've been following, and it's what I've said consistently. And let me bring it up here. So this group right here, 20 to 29. And it's basically at 405, and it is the largest growing numbers that we're getting, but these kids aren't getting tested. So as the more of them are getting tested, with the college kids coming back and testing in place, you're seeing a huger number. And the problem with that number there is that they're the ones that are going out and affecting everyone. And yes, parents, again, I will say this. Yeah, it's your kids between the ages of 20, and I got 2 of them between the ages of 20 and 29, and I talk to them consistently about this. They're the ones that have no signs or symptoms, but are out there. And the next group would be your 50 to 59 at 341, but then you have your 30 to 39 that's at 279, and it goes down from there. And then again, we always watch the 0 to 9 because we got 40 cases that that's we obviously with the children. And then the 10-year-old to 19 is 133. So these are things that we consistently are looking at. And then you look at the matrix here. And when we said we plateaued and we thought we got there, and you can steadily see that it's starting to go up just a little bit. We're going in where we had that apex that we thought we hit, and now we're going the other way. not largely, but if you look at the numbers, the amount of people that got tested, if you look here, look at the work here, but that was the biggest peak. But then you see the amount of people still getting tested and the positive numbers coming back. And I always tell everyone the zip code, unfortunately 12203 in the city of Albany has the highest rate at 305. And it's still affecting more females than males here in Albany County for some reason. So we have a bigger population of females, and it breaks down from there. And at the 122, 47 were males and 75 were females. But we still, one of the numbers with the mobile testing that we've been tracking with the minority communities and underlying issues in different communities in Albany County is that we're still seeing a huge population of African Americans going into the hospitals, more hospitalization stays than anyone else, but it seems to, for some reason, be affecting females more than males. And total tests at 65,000, all that other stuff. But it's the, you go to the state, and you can see the total people tested 65,000, 2,032 they have. That's the data you can get off the state dashboard too, that keeps everything going. So I just wanted to bring that up. I know Dr. Whalen usually does that, but these are things that as we move forward, look, we're in this together, and I keep saying this. The only way we're going to get through this is by taking this serious. It's there. It's not gone. It hasn't gone away. I know people are tired. I know my staff's tired. I know workers are tired that have been the essential employees that have been dug in for 18 weeks, and they weren't able to stay home for 16 out of the 18 weeks and protect themselves and their family and do the right thing to stop the spread. And I know these workers are tired, and I know everyone in general is. They're over it. And I wish I had a dime for every time someone said to me, hey, look, I'm over this whole thing. Well, it's not over you. And, they're like, I don't have a chance of catching this. And I said, well, you have a lesser chance of hitting the lotto, because I know that's over 100 million. So I think that's 1,000,000 to 1 hitting the lotto. But you do have a better statistical chance of getting the COVID-19. I can guarantee you that. And it's the truth. And if people want to say we're fair-mongering, we're trying to scare people, yes. Compared to the flu, listen, we take our guidance from the feds, from the state, from CDC, from the health community. And if you look at what has happened in Italy and China and everywhere else around the world, it's real. It's real. And the last thing you want to do is starting to open up and shut down. Florida's, they ran out of ICU beds. Their capacities are going through the roof. The debate, I can't believe, because we're into this 19 weeks, that people are still talking about masks. Is it good? Is it, debating, I have a freedom of not wearing a mask. Yes, you do. Walk by yourself, people. Don't be that person in the car driving by yourself with the mask on, because that does still make me laugh when I see someone driving by and they have their mask on. But go by yourself. Go for a walk. Drive in your car by yourself. You don't have to go out in public. You can avoid everyone. Yes, it is your right to go out and do what you want to do, but also protect the people around you. And I've said that. You might not care about yourself, but care about them people around you. And to the parents with the 20 and 29-year-olds that have been traveling in these leagues, go get them tested, parents. Do the right thing. Because if you don't have an underlying health issue, your parents might, if they're still alive. Or your friends might, and they might not share that with you, because it's not like a 30-year-old or 40-year-old is going to say, I have this underlying health issue. It's none of your business, but protect them. It takes 3 minutes to get tested, you're done, and Or if they're traveling, self-quarantine for 14 days when you get home. Just self-quarantine. That's it. Do the right thing and stop. I know you want your kids to be kids. I get it. I have a 16-year-old that is driving me crazy with TikTok and every other thing that they like to do. And, I'm losing a battle to go get my nails manicured this week, for real, so I'm going to bring Steve McLaughlin with me. But again, I know people are losing it and they want to do stuff. I get it. So, switching gears a little bit, this third week of our Summer Fun and Go-Hos program, providing outdoor social distancing games, activities for kids. Cam Jam, Bago, karate lessons, crafts, We're doing a lot of different activities, which has been fun. But one of the things I do want to mention, which was nice, we got a nice email from a mother, Erin, who really didn't want to bring her child there, didn't feel safe, but wanted to do something for the child. And she went there, and then she saw how we have all the safety protocols in place, and we're doing this and letting kids do it in a safe way. She said she cried, and it brought tears to her face because of the fact that her kid got to go out and do something, and obviously in a safe way, being a parent worried about their child. So Erin, thank you for that letter. We do appreciate it. And to the Department of Recreation and to Mayor Kaler and the City Cohoes legislators, thank you. This has been a huge hit, and we're going to continue to do this stuff throughout the county. Which is why I'm excited to announce we will be launching a summer fun in Bethlehem for the week of August 10th through the 14th, and you can register on our website shortly. It's not up yet, but it's going to be for the town of Bethlehem. We're going to be doing the same thing we did in the City of Cohoes and Green Islands and Watervliet. So please, by all means, get on board and get your kids to go out there and do something that's in a safe manner. So we're week 10 of the Albany County Stay Safe Teen Challenge that we started in partnership with the PAL and AT&T. Can't thank PAL for their commitment to the children of the city of Albany and to the county and to the Capital District, and to AT&T being a great partner. But this week's theme is staying close and sharing memories. So please bring out the old pictures. I actually started seeing it on Facebook. I'm like, wait, that person can't be there, and it's a picture from a year ago. So note to self, either put glasses on or pay attention to the year they're posting the picture. But yeah, share them about what it looked like then and what it looks like now. Kind of a cool challenge. So again, you can get a $25 gift card, in partnership with AT&T and PAL. So thank you for that. Please submit that stuff, as always, by Saturday at the hashtag Albany County Stay Safe by July 25th. So I want to remind people who are going out to eat around who are eating on Lark Street, we have a private lot that's Albany County's lot. It owns right on Central Avenue. So we're opening that free for the weekend, working with the Lark Street bid. So if you want to go and have some great food and walk around Lark Street or Washington Park, our lot is 208 Washington Avenue, and it will be available between Friday and Sunday from 6 p.m. to 9 a.m. on Friday, obviously, and then all day Saturday and till Sunday. And the lot's right there. I think Spruce Street's behind it, and you got Lark Street. It's kind of on the corner right there, across from the old QE2. But park there, walk around, go to the park, go get something to eat, and don't worry about have to getting a ticket. So that will be available this weekend. I want to thank Lark Street Bid for reaching out to us on this and working with everyone in there, and Matt Peters, the legislator, for making this happen for the people of Lark Street. So again, please, by all means, use it. I also want to remind businesses you can get the hand sanitizer at our Times Union Center, the OC in Clarksville, or get it to you by always calling the Times Union Center or stopping down there off of Market Street and the loading dock in the back, and you get 2 gallons each. But you can call the Times Union Center at 518-487-2023 from 8 a.m. to 6 p.m. And then our mental health department, thank you for what you're doing. 7 days a week, 8 a.m. to 5 p.m., area code 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And our 211 and our 1-888-364-3065. And a special shout out to my sister Kim, who turned 60 yesterday. Happy birthday. And to my brother Kevin, who turned 65 today. So happy birthday to you too. I want to say again, happy birthday.